Welcome to Part 1, the 10 Tales of FEM, A-HIT Hybrid CBE Mastery Learning Program. Let's get started. Upon completion of this presentation, you will be able to explain how performance indicators support the competencies and describe types of student activities that would promote the appropriate level of mastery for competencies based on the Miller's Pyramid. Unit 1, our focus today is Applied Sciences. What does Applied Sciences encompass? Well, through the lens of a health information technologist, Applied Sciences encompasses methods of effective communication while utilizing technology, health science fundamental courses, fundamentals of statistics, healthcare delivery, and social determinants of health. The 8 competencies in Unit 1. In Unit 1, the competencies that we have are 1.1, written and oral communications. This competency has 4 performance indicators. Competency 1.2, technology competence, has 2 performance indicators. Competency 1.3, anatomy and physiology, has 2 performance indicators. Competency 1.4, medical terminology, has 3 performance indicators. Let's look at the second half. Competency 1.5, pathophysiology and pharmacology, has 4 performance indicators, while competencies 1.6, 1.7, and 1.8 have 2 performance indicators. We have 1.6 is healthcare service delivery, 1.7 is fundamental statistical concepts, and 1.8 determinants of health. Competency 1.1, written and oral communications. Miller's reminder: at the DOES level, a student should be able to demonstrate how to perform a task or process. Imagine giving the student a patient case to code and having them record a video where they walk you through how to use 3M encoder to assign the appropriate codes, present on admission codes, and arrive at the DRG for the case. That is a prime example of DOES. The same as if you provided the student with a patient case that was already coded and asked them to validate the accuracy of the codes and provide logic with correct codes for any codes that are inaccurate. This is a form of teaching as they walk you through something. Keeping this in mind, we measure student mastery attainment at the competency level utilizing the College of Health Sciences A-HIT FEM competency outcomes, those bullseye rubrics. Our performance indicators are those tasks, processes, and/or knowledge and skills we expect students to be completing that meet the competency. This is true of all of the competencies at the associate and bachelor level for CAHIM accredited programs. So looking at those performance indicators for competency 1.1. Now, here is the thought process. So as we look at these performance indicators, think about this. The student is performing or completing written and/or oral communication skills in a professional capacity through, it may be one or all of these, right? Thinking about the assessment that you're looking at. So we have these 4. We have used proper grammar and spelling in written communications, ensure thorough and logical explanations founded on evidence-based information, include proper scholarly or professional literature citations in written reports, select or develop graphical representations and images to enhance communication and demonstrate appropriate understanding. With competency 1.1 written and oral communications, think about writing this as an action, right? Like we would for our course level outcomes or even our lesson outcomes or learning objectives, right? So in this case, I'm going to put formulates professional quality written and oral communications. Now we have something we can measure the student at. So our Miller's level for competency 1.1 is does. So this is all in how we do the frame of reference. Recall in the previous slide the student standing up talking to a group of peers. She is presenting. The student is performing, completing written and or oral communication skills in a professional capacity through. So if the student is very polished, their written or oral communication skills are well above standard, you would click on the exceeds mastery. Although it reflects 3 points, there are no actual points associated with the College of Health Sciences AHIT FEM competency outcomes that go into the student's gradebook. So no impact to the assignment. However, we're able to track the student's attempts at attaining mastery on selected assessments throughout the program. Now, look at this from a different perspective. How about the student stands up, or rather utilizing either a live session or recorded presentation, the student struggles to present their slides or give a talk, or whatever it is the ask may have been. Their presentation is poorly developed and not easy to follow. The student is looking down most of the presentation, or their voice is really low, like they are whispering to truly not be heard. How many of you have experienced that? I'm sure you've experienced that in some of your teaching, where a student talks really low. It's just usually because the student is not quite prepared to give the presentation. It could be they didn't have the time to dedicate to truly develop that presentation, or perhaps they didn't understand the assignment and just maybe were too embarrassed to ask the questions. So in this situation, going back to this, in regard to the student attainment of mastery in written and or oral communication at a professional level, we would deem this level of performance to be more at the in progress, right, according to the bullseye rubric. Again, there are no true points on the student's actual assignment here, so it does not impact their grade, other than if the student is in progress, the actual grading rubric criteria on their content or tasks should reflect this in some way on how you grade the overall assignment. So again, looking at the mastery rubrics, we can see it has a bullseye. You can clearly see it tells us competency 1.1 written oral communication. It does list each of those performance indicators. Remember, our tasks, our processes, that knowledge or skill set we're looking at. And also included here for you and for the student, it talks about the examples of Miller's at that does performance level, right? So you're observing the student's ability to perform, demonstrate, completing competency. So at this level, the student should be able to walk someone else through doing something, a form of teaching, developing policies, procedures, tools, resources, workflows for a specific competency focus area for the students, or they are completing complex projects or tasks that mimic industry processes or tasks. So that's just like an example of what the student should be doing at this level. So don't think about the points on the top. I know it says 3, 2, 1, 0, and ultimately for us, mastery would be this 2, right? The here where it says meets mastery. This is where the student is at that appropriate level of learning. They are meeting the competency, but when we say that they exceed, this is where you're saying that the student really has stellar work. Now, this is not saying it wasn't an A quality work or that you didn't give them 100% or 90% or whatever it may be. This is saying that this particular assessment, right, the student submission really shines. It stands out amongst other students. They went above and beyond in completing their assignment. That's what we're looking for at exceeds mastery. When the student is in progress, like our example, they're falling below meeting the necessary requirements for mastery, but they are demonstrating some level of competence. So they may not be hitting everything, but they're at least hitting enough to show you that they are beginning to learn. They just are not as far advanced as we would have expected them to be at this point. But this is a great opportunity in your feedback to provide some suggestions of things that the student may want to like reference or research, things that you want to help them hit home with to help more connect and understand what they need to do at this level. Maybe this is even offering some of your time to meet with the student and go over things. Now, the last one on our mastery scale here for the bullseye rubric is the little evidence. This means that the student work is of poor content quality, right? So it's missing lots of things. There's lots of things that just don't make any sense. There's no flow. They're not meeting the content that we're looking for. Or it could also be that the student hasn't submitted anything. That's when we would use the 0. And remember, again, the actual points here, as you can see in the grade point aspect, do not have any points. There's no weight that carries onto the student's grade book, other than just we are tracking the mastery of the student on all of these competencies. Competency 1.2, technology competence. All right, so here we are. We're looking at those task processes and or knowledge and skills we expect to see students completing that meet the competency related to technology competence. So I created the little bubble again. This is where you're going to ask yourself, right? This is what we're looking at the student doing. So the student is performing or completing technology competence confidently by using digital technology, networks, and communication tools to find, evaluate, and communicate information. Or they may be using software packages that allow for the analysis and presentation of the data that they're showing. Competency 1.3, anatomy and physiology. Competency 1.3, anatomy and physiology, typically at the nose level, as we can see here. This one falls under nose. But at the nose level of Miller's pyramid, students are able to easily identify and easily describe something or how it works. So for competencies 1.3, 1.4, and 1.5 relating to those health science core knowledge, AHIT and BSTM HIM students will be able to utilize their knowledge, skills, and abilities to perform real-world tasks such as reviewing patient medical record documentation, to identify when there is a need to query a physician for clarification of a diagnosis or procedure based on existing or missing documentation, as well as for assigning accurate codes to the patient encounter for billing and reimbursement purposes. So here again, put yourself in the position of asking, as you're assessing students' work, thinking about the anatomy and physiology competency, the student is able to, either one or both of these, identify musculoskeletal and physiological body systems and functions, and or integrate knowledge of body systems and functions in decision making. Competency 1.4, medical terminology. Competency 1.4 is at the Miller's level of does. So a great example of does is going back to the conversation on the student reviewing patient chart documentation to assess accuracy and or completeness for assigning the highest level of specificity of codes. So a student may also be asked to complete a project that involves selecting a condition to research and teach about in a knowledgeable presentation on the condition or disease process and any potential treatment options, along with other side effects. So this is where we ask ourselves, as we're assessing the student's mastery of competency, is the student able to do one or more of the listed performance indicators? So in this case, we want to know, can they integrate prefixes, suffixes, word roots, and combining forms of medical terms? Interpret proper phrases and terms of diseases pathological conditions, and systems of the body, or use medical terminology and abbreviations within the correct context. Competency 1.5, pathophysiology and pharmacology. For competency 1.5, the Miller's pyramid level is nose. So again, ask yourself as you're assessing the student's mastery of the competency, is the student able to do one or more of the listed performance indicators, right? Those processes, those tasks, that knowledge, skills, and abilities. So are they able to recognize the physical and functional changes that occur within the disease, injury, or throughout the human life cycle? Describe diagnostic and therapeutic tests and procedures in disease processes and interventions. Are they able to identify generic and brand name pharmaceuticals and the indications for commonly prescribed drugs and agents? Are they able to identify contraindications and side effects associated with drug therapies? Competency 1.6, healthcare services delivery. For competency 1.6, we are at the Miller's pyramid level of nose. So again, I ask you to put yourself in the position of, as you're assessing the student's learning, ask yourself, is the student able to do one or more of the listed performance indicators? So in this case, is the student able to readily identify types of healthcare organizations and systems, and or differentiate the scope of health professionals and healthcare services in various settings? Competency 1.7, fundamental statistical concepts. For competency 1.7, we are at the Miller's level of shows. So at the shows level of learning, the student is now expected to be able to model skills through completion of simulations such as role-playing, addressing more complex cases, completing authentic assignments that are just like those in the field, or provided by a supportive healthcare organization to promote the learning with smaller projects, etc. So an example of performing at the shows level is you provide the student with a case scenario or scenarios and ask them to select the appropriate statistical formula to solve the case. So as you begin to assess the student's mastery of this competency, ask yourself again, is the student able to do one or more of the listed performance indicators? Are they able to demonstrate understanding of statistical terminology? Are they able to calculate descriptive statistics and solve fundamental statistical problems? Competency 1.8, determinants of health. For competency 1.8, we are at Miller's pyramid level of nose. So again, ask yourself as you're assessing the student's mastery of the competency, is the student able to do one or more of the listed performance indicators? Are they able to recognize the determinants of health's impact, individual, community, and population disease and health? And or are they able to identify the social determinants of health and clinical documentation? Thank you so much. This wraps up our first presentation with Unit 1 of the AHIT FEM competencies.